Hi there, welcome to my video about Naproxen. This is a short and to the point version meant for patients, and it will learn you how and when to use Naproxen. I will tell you all the things to take into consideration, like can you use it with alcohol, can you use it in pregnancy. I also made a more in-depth version, and you can find the link into the description if you want to know a little bit more. So I first wanted to start with a little disclaimer. This video is meant purely informational. This is not medical advice. And if you're looking for medical advice, please contact your own doctor. Then Naproxen is a generic name and is also known under the brand names Aleve, Naprosynm and Anaprox, and is available in tablets. Then when do you use it? You can use it to lower your fever, so in common cold or in flu, and you can use it to experience less pain, and it's suitable for any form of pain, headaches, muscle strains, arthrosis, menstruational pains, doesn't really matter. And lastly, it can also be used in an acute gout attack to lower the gout attack. How do you use it? Usually you take it before or after your meal. Before the meal it works a little bit faster, and you wait between 8 to 12 hours between doses to stay on the correct level, not too much and not too low. How long can you use it? Till your complaints are over. But if this takes more than 10 days, you should contact your doctor, because maybe another treatment would be better for you. If you use it for headaches, then make sure to only do so a few days, maximum up to 2 weeks, because otherwise the use of Naproxen can induce headaches, and this is not what we want. Then if you use it for migraines, make sure to only do so when you have a migraine attack. And if you're experiencing more than 2 migraine attacks each month, this would be a reason to contact your doctor, because maybe other treatments would be more effective. Then regarding safety, Naproxen may lead to vertigo, dizziness or fatigue. If you're experiencing those side effects, then it's not safe to drive and you shouldn't do so. But if you aren't having these side effects, it's perfectly safe to drive while using Naproxen. Regarding alcohol, alcohol may increase the side effects of Naproxen, so test out what the effects are. And if you're experiencing more side effects, please don't combine it with alcohol, otherwise do so in moderate ways. And regarding food, there are no real restrictions, you can eat everything you want. For the dosage, always use the lowest effective dose to minimize your side effects. And if you're taking Naproxen for fever and or pain as an adult, you can use 200 to 250 milligrams every 8 to 12 hours if necessary, upwards to 750 milligrams a day. And for elderly, this maximum is only 4 to 500 milligrams a day. For children older than 6 years, you can use a maximum of 10 to 11 milligrams per kilogram a day, divided over 2 doses. You can do this in a maximum of 3 days. If after 3 days the child still needs Naproxen, you should contact your doctor, because maybe another treatment is more effective. Then for children older than 12 years or more than 50 kilograms, 250 milligrams a time is allowed every 12 hours, upwards to 500 milligrams a day. Then if you take Naproxen for joint disorders like arthrosis, then adults can use 375 to 750 milligrams divided over 2 doses. And for short-term use, even 1000 milligrams a day is allowed divided over 2 doses. For children older than 6 years, a maximum of 10 milligrams per kilogram divided over 2 doses can be given. Then if you take Naproxen for a gout attack, start with 750 milligrams, add 500 milligrams after 8 hours, and then 250 milligrams after every 8 hours till your gout crisis is over. This will help you to experience less pain and have less inflammation. If you take Naproxen for migraine attacks, take 500 milligrams a time, once a day. And for short-term use, you can even use up to 500 milligrams twice a day, but only do so for 1 week maximum. Then we're looking at side effects. Naproxen has a lot of side effects, so make sure to check your prescription if you think you're experiencing one, and always contact your doctor if necessary. I put here the most often ones, so you can experience heartburn, nausea, stomach pains, constipation, headaches, dizziness, thirst, diarrhea, vomiting, palpitations, and some others. So make sure to check your prescription if you think you have a side effect. Then my last bullet point, pregnancy and lactation. Naproxen is not safe to use when you're pregnant, especially in the first and third trimester, and it may be harmful for you and your baby, so please don't do so. Regarding lactation, Naproxen passes in the breast milk and may be harmful for the baby, so please don't use Naproxen while breastfeeding. This was my short overview of Naproxen, how and when to use it. If you want a little bit more information, please check out my professional in-depth version in the description and subscribe for more future videos on medicine or medical content. Thanks for watching and see you soon.